Hello friends, so we are back with the new topic and our today's topic is diet counseling. Diet plays an important role in our dental health as well as in overall health. So who should give the diet counseling? Dental surgeon, hygienist or nutritionist who are having dental degree or nutritional degree with the updated knowledge can give the diet counseling. So the next question is where the diet counseling should take place. The diet counseling should be done in the consultation room or any room which is free from distraction and anxiety producing elements. There are some important points which should be taken care of during the diet counseling. First, whenever you are giving diet counseling to the person or the child or the parents, do not be judgmental. You should not be judgmental about his or her diet. Second, not to emphasize the role of sucrose, because if you will emphasize the role of sucrose before the diet counseling, then the patient will present the ideal diet. Then third, patients should not be lectured before the diet counseling. Otherwise, they will try to present ideal diet in front of you. Then next, the diet counseling session should not exceed more than 45 minutes. Now, coming to the counseling design, how you should do the diet counseling is very important. First appointment before counseling, determine what the child is eating and when the child is eating. Amount of intake, frequency of intake and time of intake is very important. The diet counseling session should be of 15 to 20 minutes at the first appointment. Then the diet diary is introduced. Before that, briefly discuss about the diet. Explain to the patient that we are looking for the possible dietary cause of caries and the diet should be recorded for 24 hours and it should be recorded for a 1 week or the 6-day diet diary prepared by the parents at home. The parents should monitor each and everything about the diet of their children. Then coming to the process of diet counseling, first the 6-day diet should be analyzed. Then the second step, isolate the sugar factors from the chart. Mark the sugary content or the food having sugar in the chart and isolate them. Then third, educate the patient role of sugar in caries. Then fourth is the consumption of easily available substitute for sucrose. Then next is the provision of continuous positive reinforcement. Whenever patient is maintaining the diet and reducing the sugar factor, you should encourage the patient and always reward the patient. By this method, they can maintain their diet or reduce the sugar exposure. Coming to the sugar clock, Stephen and Miller in 1940 did an experiment and find out that within 30 minutes of taking of sugar intake, there is decrease in pH of the oral cavity. So the food which is taken within the 30 minutes of the meal will have the less detrimental effect as compared to the food taken between the meals. So to maintain the sugar clock, we should be aware of these things. Abstract from frequent snacking throughout the day, decrease the intermittent food intake, and then decrease in pH of oral fluid below the critical pH. So not only reducing the amount of sugar will decrease the caries prevalence, but reducing the frequency of sugar intake will help in reduction in caries. So the next is diet diary. Diet diary should be maintained, and in diet diary first we should mention whatever we are taking, solid or liquid, for 6 days. Then record the food which is taken between the meal time, between meal, during the meal time, soda or anything, any beverages, and whatever while watching television, while walking, etc. Then the next step will be record anything which is sugary, chewing gums, candy, cough drops in which sugar is found. Then next is always measure anything in the size of 1 cup, 1 tablespoon and 1 teaspoon, whatever you are taking. Then also mention whether the food or anything which you are taking is cooked or raw, whether it is baked or raw. Then coming to the food pyramid guide is very important in maintaining the diet plan. It is a type of visual guide to show how much each type of food is important for a balanced diet. In this, the food is divided into different categories in shape of pyramid. At the bottom, there will be main component like bread, cereal and rice, in which the important serving is 6 to 11. Then the second step is fruits and vegetable, which should be taken in 2 to 4 servings. Then next step will be the meat, fish and nuts, which is taken 2 to 3 servings. And then the cheese, milk, yogurt, these all things are also taken in 2 to 3 serving. Then the apex of the pyramid will be the fat and sweet and salt, which should be taken sparingly. So this pyramid explain what kind of food we should take more and what kind of food we should take less. Then coming to the dietary advice, which should be different according to the age group. Then coming to the dental health diet score, in which diet health score is calculated. First, the step 1 is list everything whatever you are eating and drinking within the weekdays and along with the time. What time you are taking, at what amount you are taking and how the food is prepared, and also mention number of teaspoons of sugar or anything which you are taking for weekdays, and also mention the frequent snacking in between the meals. List everything out. Then the second step will be circle the food in the diary with the added sugar and classify the uncircled food or the dish, and then the check mark. If it is taking after 20 minutes, it should also be mentioned. This step is called isolation of the sugary component. Then the next step is how many essential component of the food the child is taking. Then the fourth step is calculate the amount of sugar the child is taking. Then the step 5 is watch out zone, food group barely adequate. It means your nutrition is not proper and this is the watch out zone. Then the total score is calculated. For the sweet liquid sugary item, multiply it by 5, and for solid sweet, multiply by 10, and for slowly dissolving sugar, multiply it by 15. Then the next step is watch out zone, where you will pay attention to the balanced diet. Calculate the score by adding all the components, and if it is 72 to 96, then it is excellent. If it is 64 to 72, it is adequate. And if it is 56 to 64, it is barely adequate. And if it is less than 56, the diet is not adequate. 60 to 100 is the acceptable group, and the diet counseling should be given at only patient's request. Then the next step is communication and motivation. Communication and motivation is the key to successful diet planning. So motivate the patient. Then the next step is recall. After a successful diet planning or diet counseling, recall the patient to see the result after isolating the sugar factors. The recall period should be 2 weeks after the diet counseling. This is the visual representation of the diet chart, how it should be prepared. Prepare the 4 column, in which first column will be mentioning time, second column will be food, third column will be amount of the taking food, and fourth column will be the description whether the food is cooked or raw. And for each and every time, you should mention about the food and how much you are taking and what kind of food you are taking, and explain whether it is cooked or raw. By this method you can prepare the diet chart. Then after 2 weeks the recall should be done. Suppose at 10 a.m. you are taking rice, dal and salad, at 12 p.m. you are taking soup, at 6 p.m. you are taking tea, and at 7 p.m. you are taking chocolate. So mention each and everything with time and with the amount. You are taking rice dal salad 1 serving, soup 1 bowl, tea 1 cup, and chocolate 1. And everything will be cooked or raw. By this method, you can prepare the diet chart and show it to your dentist. You can also mention the frequency of the food item you are taking. So this was all about diet counseling. Comment down your queries in the comment section.